Welcome to Get Moving, Breathe Easy, Session 4 of the learning series Living Well with COPD by RESPIPLUS. Living Well with COPD is a comprehensive, self-management education program which successively improves people's lives. Today, we look at why it is so important to keep physically active when one has COPD and how to do it. Let me introduce myself as I will be accompanying you through this exciting series. My name is Becky Zuko, and as an exercise physiologist, I've had the opportunity to help many people with chronic disease improve their quality of life through exercise rehabilitation. In this session, you will learn more about the importance of being active, how to increase your level of physical activity, how to safely perform physical activities, and how to continue to be active in the long term. Despite constant breathlessness, it is very important for people with COPD or any other chronic respiratory disease to keep active. Otherwise, they gradually lose autonomy and quality of life because of persistent fatigue and reduced tolerance to effort. Living well with a chronic pulmonary disease means getting moving to breathe better. Why must we increase our level of activity? Because activity helps you better control your shortness of breath, increase your strength and your tolerance to effort, better control your anxiety, increase your confidence in your own abilities, and improve your quality of life. It is recommended that you do 30 minutes of physical activity per day. Time spent on physical activities can be spread out according to what is convenient for you. For example, 3 10-minute periods are just as good as a single 30-minute session. Getting some physical activity every day is easier than you think. Here are some examples. Walk indoors or outdoors. Use a stationary bike. Climb stairs, taking time to rest when needed. Leisure activities, yoga for example, and daily life activities such as housework also count. You should aim to maintain your level of physical activity in the long term. If you enjoy outdoor activities, you should plan an activity for each season, such as cross-country skiing in the winter, gardening in the spring, cycling in the summer, and hiking in the fall. Consider some indoor activities as well, which have the advantage of not depending on weather conditions: gym, stationary bike, or swimming. Your level of performance can vary over time. What is most important is to be regularly active. Here are some suggestions to help you increase your level of physical activity. Set aside moments of the day when you feel well to engage in physical activity. Avoid physical activity immediately after eating or at night before going to bed. Avoid environmental factors that are likely to increase your symptoms. For example, extreme heat or cold, high humidity, smog, or strong winds. Wear comfortable clothes and appropriate shoes. Invite your friends and family to join you in physical activities. What happens when you have an aggravation of your COPD symptoms or an exacerbation? You should reduce the intensity of your physical activity or stop it temporarily until the symptoms have improved. Remember to use your action plan, if you have one, and contact your resource person. Contact your doctor or healthcare professional if you are unable to resume your physical activities following an aggravation of your COPD symptoms. Control your shortness of breath by using the pursed lip breathing technique. Remember, inhale slowly through your nose. Purse your lips as you would to whistle. Exhale slowly while keeping your lips pursed. Do not force your lungs to empty completely. If you are not familiar with this technique, ask your doctor or healthcare professional about it. How can you tell if the intensity of your physical activity is adequate? Start at a comfortable pace It is normal to experience a light degree of breathlessness. Use the scale of perceived exertion. Looking at the scale, evaluate your level of breathlessness between 0 and 10. Then again, using the same scale, evaluate the intensity of your muscular fatigue. It is recommended that you perform physical activity at a level of breathlessness and fatigue between 3 and 6 on a scale of 10. What are the normal and abnormal symptoms that can be present during physical activity? Normal symptoms are light to moderate breathlessness, sweating, the feeling of heat or fatigue in the legs, and a light muscular or joint pain. If you present any of the following abnormal symptoms, you should stop physical activity temporarily and contact your doctor and/or healthcare professional. Chest pain, intense joint pain, dizziness or vertigo, heart palpitations, severe and prolonged respiratory problems, and headache. Counting your number of steps will encourage you to go a bit further every day. You may use a pedometer, Fitbit, or other step counter from your cell phone. You'll be able to challenge yourself and observe your progress. Here is the 3-step pedometer technique. In order to determine the average number of steps you take every day, note the number of steps you take over 3 consecutive days, making sure to include 1 weekend day. Your first objective will be to add 1,000 steps to your daily average. Maintain this level over a 1-month period. If you reach your goal, add another 1,000 steps and maintain this for 1 month. Keep increasing your objective in this way. Register at a gym or a community centre or join an aqua fitness programme. Gyms and community centres offer a variety of programmes that could be suitable for you. Maybe you would like to engage in a physical activity with friends or in a group. Inquire about programmes available in your neighbourhood. You may find yourself unable to increase your level of physical activity despite using the recommendations made in this session. If that is the case, speak to your doctor or other resource person to discuss the things that keep you from being more active. There are other alternatives, such as being referred to a pulmonary rehabilitation programme, where you would be supervised by a team of healthcare professionals who would guide you in the practice of exercises adapted to your health condition. You can inquire about existing pulmonary rehabilitation programmes in your region by consulting the website of the Canadian Lung Association. Are you ready to increase your level of physical activity? Can you identify at least 3 physical activities you would like to engage in? What is your plan for maintaining your physical activity level in the long term? Now you understand the importance of being physically active and are motivated to increase the level of activity in your life. Only you can make this important step forward. By being more active, you will have better control of your shortness of breath, be able to accomplish more and increase your quality of life. Keep a positive outlook. Be creative. Try something different and reward yourself. Your body and spirit will be grateful. Have fun. To learn more about today's topics, consult the brochure Get Moving, Breathe Easy, available for free at www.livingwellwithcopd.com. We would like to acknowledge all the professionals and patients who have contributed their time and thoughts in order to enrich the Living Well with COPD programme, especially Mr. Bill Nash. Their dedication and help have allowed us to continue enhancing the lives of people living with this disease and their loved ones. Thank you.